Welcome. I'm Erica Lyon, and I'm the director of Real Birth and the author of the Big Book of Birth. And today we're going to talk about signs of labor. What we will begin with is some preliminary signs that indicate your body is moving you nicely into a state that makes you ready for labor. And these are called pre-labor signs. And basically, there are two very important ones. So when we're talking about pre-labor, the very first thing that's going to happen that shows that your body is moving you into a state ready for labor is that the baby is going to drop. What this means is that the baby is going to rotate to a head down position and drop low into the pelvis so that it is in place ready for labor. Other words for this are also that the baby will engage or that the baby or the mom will experience lightening. And what does this mean inside our body? If we take a look inside a pregnant mom, and we see what's going on with the uterine muscle and her cervix prior to labor, we can see here that the cervix is nice and thick and firm and closed and sort of basically holding the baby in. And here we have the uterine muscle, and what's going to happen when the baby drops is that the baby sinks lower into our body and the cervix also begins to change. Now, the reality is the mom is usually the very first person to know that the baby has dropped or that the baby has engaged or that she has experienced lightening. Keep in mind that these words all mean pretty much the same thing. It's called lightening because the mom gets some relief from all of the pressure under her rib cage, and she literally feels a little bit lighter as the baby drops lower. But the other thing that happens is that she starts to feel a lot more pressure behind the pubic bone. So often the mom experiences this over the course of a couple of days, that she is getting an intensification of pressure behind the pubic bone, and she'll often come in for her checkup to her doctor or midwife and say, I think the baby has dropped. Yes, the baby has dropped. It's nice and low in the pelvis, ready to go for labor.